Hello, I'm Dr. Hakan Cift from Kırıkkale University, Orthopedics and Traumatology. I'm specialized in shoulder and elbow surgery. Today we will talk about shoulder joint dislocations. Shoulder joint is the most common joint dislocated in the body. And it can be dislocated anteriorly or anterior inferiorly, posteriorly, and in the other positions too. But 95% of the dislocations are anterior dislocations. So we will talk about especially for the anterior dislocations of the shoulder. It can be traumatic or atraumatic. And with the patients, they complain very painful joint and they are not able to use their extremities. And also they can easily see humeral head, a deformity on their shoulders. So they can't move their arm, they can't move their shoulder because of the pain. It's an emergency for the orthopedic surgeons and we should immediately relocate the joint. So when the patient visited the emergency room, we first make a good analysis of the patient and then we look for the neurovascular structures if they are damaged or not. Then we took X-rays and with the X-rays we search which side of the body is dislocated and also is any fracture with the dislocation. After that we immediately relocate the shoulder joint and put a splint on the patient. With all of this, for the first time dislocators, there's a debate. Should we operate them or should we leave them with the physio? But if they're a sportsman, then we should operate even it's the first time dislocations. So what are the points of the recurrent dislocations? For the recurrent dislocations, the parts of the bodies that limits the shoulder and leaves the shoulder humeral head in the joint damaged. Usually we call the labrum with the damaged part. As we can see, this is a left shoulder. You can imagine this is a left shoulder. This is the humeral head, and this is the rest of our body. And when we look at this part is the anterior part, and this part is the posterior part. So we are looking from the anterior. And if the shoulder dislocates, it's like this. The humeral head goes anteriorly or anterior inferiorly. And here, as you can see, there is a labrum over here that limits these dislocations. But if there is a dislocation happens, then this labrum is torn. So what should we do? We should relocate the joint and leave it for healing. And then for the recurrent dislocation, we should make a repair of this labrum. So this is very important for us. What will we do? We usually do all these procedures for the treatment operations with arthroscopically. What is arthroscopically? We put about 1 centimeters holes on the bodies and about 4 or 5 holes, and from these holes with the help of the camera we do all our procedures without opening it. So after the operations, patients have less pain and easily move their shoulder or arm. So what will we do with this recurrent dislocations? First of all, we can repair this labrum and we call this operation Bankart repair. Or sometimes there are problems with the bones or the cartilage of the humerus and we put some tendons to make the stability over there. So we call this operation remplissage. And also sometimes we take a part of the coracoid, a bone near the shoulder, and we put it over there near the labrum, and we call this operations Latarje, which all of these procedures is done arthroscopically. And after this operation, 5 days later or 5 to 7 days later, we start range of motion for the shoulder, but we put a sling 4 to 6 weeks for the waiting for the heal. And how do we repair this Bankart arthroscopically? We have devices that we can use in the joint with easily put sutures on the soft tissues, and it makes us to put it really make the operation easy for the surgeons. So all the procedures are done arthroscopically, and all of them is done in our hospital. But before the operation, very important thing is preparation of the patient. Which operation is suitable for the patient? We first take X-rays, we take MRIs sometimes, and sometimes also we take CTs, computer tomography, to look for the bones. And sometimes there are associated injuries, not only the labrum tear, sometimes problems with the cartilage, problems with the bone, or problems with the other soft tissues. So we also treat this too. If the patient's age is very important for us, before 20 years old, the patients are easy to relocate their shoulders. So with these patients, we wait for them and we look for how many times they dislocate their shoulders in 1 year or in 1 month. So the right treatment for the right patient is very important, and preparation, taking a good history of the patient, and examination of the patient is very important. And after these 3 subjects, we decide a right operation to do the patient, and usually we do all these operations again, I will say, arthroscopically. So 4 or 5 holes on around the shoulder, we do all these operations. And after the operation, we start physio for our patients, and physio is the main part of for our success. And after the success, all the operation and all the physio is finished, we leave the patient for, if they're a sportsman, for their sports-based treatment physio. And it depends on if they are like handball players or volleyball players, the physio changes to the sport, or if they are swimmers, it changes, or if they are wrestlers, it changes to the sports to sports. So shoulder dislocations, we frequently see them and we frequently treat them, but the important part is to evaluate the patient, right evaluation and right operation. Very important for the patients and the operation success.